Hey everyone, I'm Lauren Fleming, the founder of Hem Supportwear, and today we have Rachael Cappuccino with us for a conversation. She's been practicing physical therapy since receiving her doctorate in physical therapy in 2014, and she founded Cappuccino Physical Therapy after having her two children, driven by her belief that an active lifestyle doesn't end with motherhood. So Rachael, we are so excited to have you here with us for this conversation today.
Thanks for having me. I'm excited to be here.
Will you start off by telling us a little bit about your background and what inspired you to become a pelvic floor physical therapist?
Yeah, absolutely. So, when I graduated school in 2014, I started in orthopedics, like I feel most people do, and
Mhm.
it was great. And then in 2018, I was kind of like, probably going to start having kids soon. There's not a lot. I like had touched on pelvic floor in school, but wasn't. I was like, whatever. I'm never going to do that. But I also had the thought that I always wanted to start my own business. And where I live, there are a ton of orthopedic clinics, like on every street corner. So it's like there's too much competition. It was like, oh, if I wanted to start my own business, pelvic floor would be a good niche because there's not a ton of pelvic PTs in the area. And then also knowing that we were going to start talking about having kids and that I would be meeting moms and I would be able to help them. And that's pretty much what happened. So I took my first pelvic floor course in 2018. And then I started doing a little bit at the clinic that I was at. And then I had my son in 2020 and then my daughter in 2022. And from there, when I did start meeting moms, I was like, okay, I think I can do this. And so that's what led me to start my own practice.
Excellent.
Yeah.
It's an exciting journey for sure.
Yeah.
And what a time to start a business and have kids.
Oh my gosh. I don't know if I recommend starting a business with two under two because my kids are 17 months apart. And I was like, yeah, let's do this. This sounds like a great idea. But we're good.
I'm honestly, I can relate to you because mine are exactly 24 months apart, and I'm in that kind of the same throes of it where I'm like, what am I doing?
Exactly. Crazy, but all good.
Exactly. Great. Well, will you tell us a little bit about, like what a typical day or what week looks like for you in your practice as both a practitioner and a small business owner?
Yeah, totally. So as a practitioner, so we see a mix. We mostly pregnancy and postpartum is what we specialize in. So in pregnancy, we're doing a lot of birth preparation, which is really fun. We have a very extensive birth prep program, which I love. And I spend a lot of time like creating and making sure that it's
Cool.
got all the info because so many people, especially as first time moms, you go into birth and you're like, what just happened? So our
Yeah.
goal is to help educate people, prepare them, things like you don't have to push on your back. You can say no to some of the things. Of course, we always emphasize as long as you and the baby are safe. If you and the baby are not safe, then listen
Right.
to your provider. So that's
Right.
really fun. And then postpartum, we do obviously a lot of postpartum recovery. So leaking, urinary incontinence, pelvic organ prolapse, diastasis recti. We see a mix of it all. Pain with sex, that's a very common one postpartum. So a lot of
Mhm.
that. And then more recently, we're getting into more like perimenopause, menopause, because we always say like it's never too late. Postpartum is forever. Doesn't matter how
Mhm.
long ago you had your kids, we can always help. So we're starting to see a little bit more of that too, which is really cool, just expanding because now we're just learning so much more about menopause. And
Yeah.
again, another area where there's no help for women. So
Yeah.
our goal is to change that. So I would say a healthy mix of pregnancy and postpartum, and then we're sprinkling in a little bit of menopause now, which is exciting. And then as a business owner, doing all the admin stuff. Like right now, I'm working on my next email marketing, which I'm terrible at. And looking at the numbers and all of that fun stuff. So it's a little overwhelming, and I'm not good at the
Mhm.
admin stuff, but we just we make it work.
Yes. Yep. Yeah. You get to wear all the different hats and you
Yeah.
constantly change them
Oh my
throughout
gosh.
the day.
So many hats. It's a lot.
Yes. Oh, great. Well, that's exciting. Will you, let's see, let's jump in maybe with, for folks who aren't as familiar with pelvic health, maybe they have no knowledge or little knowledge, how would you explain the importance of pelvic health to somebody coming at it with that kind of baseline?
Yeah, that's a great question because I would say most people come to us and they're like, "What's the pelvic floor?" I'm like, "Well, let me
Hmm.
tell you,
Yes.
it's very important." So just knowing that even like pelvic floor, it affects everyone. Even, we're hearing of young girls dealing with leaking and all that fun stuff too, not fun stuff. So I just would like them to know that it's a very important and vital component of everyday health because, some people think pelvic floor, pregnancy and postpartum, but also your bowel, your bladder, sexual function. Um, we don't do pediatrics, but young kids wetting the bed and there's just help. I
Mhm.
just wish people knew that you don't have to suffer in silence and there's help, but your pelvic floor is such a vital part of your life, your daily functioning. And so you like go get help. There is help out there.
Yeah. And I think that that's such an important point because I feel like oftentimes folks can feel like, oh, this is just how it is, like
Right.
postpartum, you leak or something
Yeah.
like that. And I feel like that's kind of been normalized a little bit. And because it's kind of taboo, people don't talk a lot about it and share that with their friends and family. They
Right.
just are kind of like, well, this is just my path now.
Right.
And so, yeah, raising that awareness of like, if something is bothering you, there's a good chance that we can work to
Yeah.
improve it. Yeah,
Yes. Okay.
even if it's not a problem, it's like if it
Right.
bothers you, it
It's
shouldn't have to bother you.
the problem and go get help. And there is help.
Yeah,
Yeah.
yeah, I think it's so important for people to hear.
Yes.
Another thing I'm curious to ask you about is what's kind of on your top list of misconceptions or myths about pelvic health that you hear and have to like actively work to
My,
overcome?
my favorite one is just do your Kegels. I'm like, oh my God, if I had a dime for any time somebody ever told me that.
I mean, so many media articles and stuff. It's so like it's everywhere.
And it's so bad because it's the worst possible
Yeah.
advice that you could ever get. Like we rarely prescribe Kegels. Kegels can make you worse, especially postpartum, especially if you have a painful condition. I get so many people are like, yeah, I
Mhm.
was doing my Kegels and my pain got worse, my leaking got worse. I'm like, well,
Mhm.
yes, because first you need to learn how to relax the pelvic floor and use it
Right.
correctly. So I would say like that's the number one thing that we have to tell people, like, okay, we're gonna stop doing Kegels, we're gonna do other things.
Yeah.
That's number one. And then another one is probably like that it's normal to pee in your pants after you have a baby. Like so many people are like, well, my
Mhm.
grandma and my mom, I'm like, I don't care what they say. No, it's not normal. Tell your
Yeah.
grandma to go get help too.
Right.
Especially too, like talking about grandmas and getting into menopause and UTIs are so common postmenopausal because of lack of estrogen,
Mhm.
and it's just like a whole thing. And this one, especially in the menopausal population, that can be helped with a topical estrogen cream. That's another myth that estrogen is bad for you. That's another,
Mhm.
I won't go off on a tangent there, but yeah, that's another myth. And there was one other one that I was going to say, I can't think of. Sorry, I forgot.
No worries. No
But there's
worries.
other two like
Like,
really, really big ones that we have to dispel.
yeah. Yeah, I know. And I do feel like they're pretty pervasive. I think a lot of people have those conceptions,
Yes.
coming into it. So
Yes.
there's definitely
Especially the Kegels. Yeah.
yes, yeah, a steep education hill to climb there.
Yes, very much so.
So another thing I'm curious about is, so I know, of course, pelvic health is a very individualized approach, which is one of the amazing things I think about getting to work with someone like you is it's that
Yes.
the longer one-on-one time and getting to really assess the whole body.
Yes.
Given that, are there kind of like tips or best practices that do apply to a general population that would put out there for folks to keep in mind for good pelvic health practices?
Yeah, so a general one, like you said, everything is very customizable, but this one I would say applies to everyone, and it's about bladder habits because we have a lot of people who
Okay.
come to us who are like, I pee every 30 minutes. I like feel the urge to go every 30 minutes. And so this is one of my favorite things to educate people on. And it's so normal bladder habits, you should urinate every 2 to 4 hours, and your stream should be 10 seconds long to 30 seconds long. If you're going too frequently, you are constantly telling your brain that your bladder is full when it's not full, and that gives you urgency. And so I can't tell you how many lives we've changed by like just telling people, I have a little handout. I'm like, these are your
Yeah.
bladder habits. Here's your bladder diary. Let's check. And then by them like extending the intervals to 2 to 4, and we do it slowly. I don't expect you to go from 30 minutes
Right.
in the middle of the
Right.
day. But they're like, wow, like I don't wake up in the middle of the night to pee anymore. And that's like, I feel like that's a huge because all sleep is very
Yeah.
too.
Right.
So that's a big one. I would say that's a really good one for general population. And then another one is to use a squatty potty when you're having a bowel movement.
Hmm.
Squatty potty, love to get the rectum in the correct angle. So
Yeah, great.
yeah,
Great. Yeah. So anybody can do, yeah, either of those.
yes, males
Yeah,
and
very,
females. That applies to
yes.
everyone. So yeah.
Yeah. Great. Thank you. Another question I have is, can you talk a little bit about how pelvic floor therapy can come into play in various stages of life? I think for a lot of people, it could be top of mind just for pregnancy and postpartum, but maybe talk a little bit about how if you aren't pregnant and postpartum or you're still in the earlier side of your life, how it could come into
Yeah,
play. And then as you kind of go perimenopausal, menopause,
sure.
that phase as well.
Yes, so definitely pre-pregnancy or even people who aren't planning on getting pregnant, we do have a couple of those patients in our population, like a couple young people who are dealing with leaking, like giggle incontinence. So that's one. And then we have somebody
Mm.
else who's dealing with pain. So she has endometriosis.
Oh
So
yeah.
those are obviously two very specific things. So again, pelvic floor it's not strictly for pregnancy and postpartum, but those are two things. So for any moms who have teenage daughters who are dealing with leaking, or especially with like gymnasts, high level athletes,
Yeah.
young athletes, that pelvic floor PT can help with that. Pre-pregnancy too. So even if you're like thinking about trying to conceive, coming in and just getting like a baseline assessment of where your pelvic floor is at and start learning how to relax the pelvic floor. We don't do this yet. I would like to eventually, but there are some pelvic floor PTs who specialize in fertility, and just kind of help
Mm.
like optimizing the body to prepare. Obviously, we're not reproductive endocrinologists, but we can like help
Mhm.
just help things along. Um, so those are some things that you can do prior to pregnancy, or if you're not planning on getting pregnant, but you're having pain, discomfort, or leaking, you can still go see a pelvic floor PT. And then getting into perimenopause and menopause. Perimenopause and menopause, you have the same issues that you do postpartum: pain with sex, leaking, pelvic organ prolapse, all those things. So similar approach to what we would do in pregnancy and postpartum. But then in that population, especially for women, strength training is so important because you're going to start losing your bone mass once estrogen starts to decline. And so
Mhm.
we as physical therapists, we're trained in muscles. And so we can come up with a strength program for you as well. So yeah, whole
Right.
spectrum.
Yes, right. Yeah. So it's like at any point in your life, it can be beneficial to know
Yeah.
someone like you.
Yes, absolutely. And then to pediatrics, which we don't work with pediatrics, but I know that there are a ton of pediatric pelvic PTs who work with like bedwetting and all
Yeah.
constipation, bowel issues for young kids. So yeah, lifespan.
Yeah. Runs the gamut.
Yes.
Great. Thanks for sharing that.
Yeah.
Well, can you talk to us about a success story that you've had with one of your clients?
Ooh, yes. Okay. Do you have a specific popular or like
We
diagnosis?
could go anywhere. Yeah. Or if you want to share one or two, whatever comes
Okay.
to mind.
Okay, the one who I'm like most recently working with. So she came in with complaints of hip pain, prolapse symptoms, and pain with sex. And so I think I've seen her like 3 or 4 times. When somebody comes in with that many things, I'm like, okay, what is the most important thing for us to address today? Because I like can look at all of them.
Mhm.
Like, let's pick one. And so she said hip pain. So I was like, okay. And hip pain can be caused by the pelvic floor. So we want to rule out all the things, but it can also come from the lower back. So with her hip pain specifically was coming from her lower back, which I found in my assessment. And so we treated her back on the first day, and I told her, I was like, I'm pretty sure this is gonna make you feel pretty good. Next week she came in, her hip pain was 75% better. So it was like amazing. So we
Mhm.
worked on that again.
Mhm.
Then we moved on to the pain with sex. So I released her pelvic floor twice, and she was still having pain with sex. So then I was like, all right, let me look elsewhere. So we looked at her abdomen. So this is another thing. Pelvic floor isn't just looking at the pelvic floor. You have to look at the whole
Mhm.
body. And she had a
Yeah.
lot of fascial restrictions in her abdomen. So I did some
Mhm.
work on that, and I told her, I looked at her and I was like, I'm pretty sure this is going to help your pain with sex. She came in this week and she had no pain with sex. I was like, amazing.
Oh,
So that was awesome.
yes.
And so then now we're working on her prolapse symptoms, which she just has some poor lifting mechanics because she lifts like heavy,
Mm.
she's a horseback rider, and she's lifting horses and kids and all
Uh-huh.
kind of stuff. So now we're working on like coordinating her breath when she's lifting
Mhm.
and making sure that she's not bearing down because she tends to bear down. So that was our most recent success story with like multiple things.
Amazing. Yeah, that's
Yeah,
huge.
which is so great. And then I would say postpartum pain with sex is something that we see very often, and in combination with releasing the pelvic floor and then using a topical estrogen cream, that tends to
Okay.
resolve pretty quickly as well. And yeah, and then leaking is also really one where like people will come in after a couple visits and be like, I was able to run a mile without leaking. I'm like, oh, amazing. So excited.
Yes, it's huge.
So,
Right.
yeah.
You start
Yeah.
getting your
Like,
life back and do the things you love to do.
yes. Yes. Seriously.
Yeah, that's great.
Yeah.
And so that it also makes me think, I know sometimes people who are struggling with something, they may feel hesitant to reach out for various reasons, right? What would you, if you were talking with them, what kind of guidance did you give somebody who's hesitant to reach out and seek help?
So definitely, I would say just, I get it. It's scary. Just do it. If you are hesitant, you have concerns, especially about an internal exam or something, let your pelvic floor PT know because they will walk you through it. And you definitely don't have to have an internal exam, especially not on the first couple visits. It does give vital information, but we're not going to do anything that you are not comfortable with because our goal is to make you
Mhm.
feel comfortable first and foremost. And then if they can, try to find success stories from other people because a lot of our business is word of mouth, which is really nice.
Mhm.
But there are people who are out there who are getting help. So try to like ask your friends because a lot of people don't talk about it, but then a lot of people are like, oh yeah, I'm
Right.
going to pelvic PT. So,
Right.
and then the other thing is not all clinics are created equally. So like make sure that your pelvic floor PT specializes in pelvic floor and that they're not just like kind of doing it on the side. Cause that's something that we see. We do
Mhm.
get people who come to us who are like, oh, I went to this other clinic, but it was just like cookie cutter. They just had me doing stretches. They didn't really watch me. I'm like,
Yeah.
ooh, that's not good.
Yeah.
So just making sure that you're asking the right questions when you call people.
Mhm. Yeah,
Yeah.
I think those are great ones, especially, where you were saying like talking to other people.
Yeah.
That's something I've experienced where, pelvic organ prolapse was completely new to me when I
Yeah.
experienced it. But the more people I've talked to about it, either through the course of, working on the business or just talking
Right.
to friends and family, like you start to then be like, oh, well, my mom has this, or my aunt has
Yeah.
this, or I think that my mom had, and you start to really hear a lot of people who are experiencing varying levels of
Yeah.
different things. And it
Yeah.
kind of opens up the dialogue too, where then
Yeah.
they're more willing to kind of talk to you about what's going on, and then you
Yep.
feel less alone and can, yeah, tap into that network of resources
Yeah.
that people have, but you may not know about.
Yes, network of resources is so important, especially again, like pregnancy and postpartum. Talk to your mom friends, see what they're having, see what they're dealing with.
Yeah.
Do they know a pelvic PT that they've been to that they love? Because they
Mhm.
find that that's super helpful.
Great. Another thing I wanted to ask about is, so I know people who are getting help, especially for our new moms, early postpartum people, a lot of that load can fall on that person.
Yeah.
How, what tips do you have for how partners can be partners or close friends or family members can help be supportive of someone who is seeking help and trying to work on that path to recovery, but maybe feels like it's all on them or it just is overwhelmed?
Yeah, that's a good question because I feel like everybody that I know, especially me, because I'm in like my young mom era, everyone is
Hmm.
so overwhelmed. Just like really explaining to your partner what's going on. And I feel like we always assume that our partner just knows what we need, which they don't. So really talking to them and also just like letting them know because sometimes partners too are like, oh, well, I can help you with that. Let me mansplain or whatever. I'm like, no, I just like need you to
Yeah.
listen and validate. So those I would say
Hmm.
are some really big things and just really making sure that they know that you need help. Like, hey, I have this pelvic PT appointment. Can you watch the baby for an hour or whatever it is?
Hmm.
Communication is key.
Yeah. And I think that's, yeah, so important. And I do think it can be hard to ask for help sometimes, but the more we do it, the better we get at it. And
Yes.
the more things we are able to then like, fill our cup and take
Yeah.
care of those things and,
Yeah, exactly.
you
Because
know,
you can't take care
go
of your
from
kids,
there.
if you're not taking care of yourself. You gotta take care of
Right.
yourself for sure.
Yeah. Yeah. Great. Let's see. Oh, another question I was thinking about is, so I know, this industry's come like a long way as far as like research techniques, best practices, and I think it continues to evolve pretty fast as we get more and more research and resources and innovation in the space. What
Yeah.
are some of your favorite ways to continuously learn and kind of stay abreast of those changes?
Yes, so a lot of continuing education courses. I love learning about all the latest research. Like I have probably 3 Con Ed courses that I need to go through right now online. And then
Uh-huh.
I'm in quite a few like Facebook groups specifically for pelvic floor PTs where they do
Oh,
like
cool.
they have experts come in and talk and do videos and they share research and stuff, which is really wonderful. But continuing education is like the number one, always staying up to date with the latest research on what's going on. Of course,
Yes.
there's not a ton of good research, but um, yeah, just trying to stay on top of it. It's a lot.
Yeah. I would imagine, especially, yeah, because you want to be at the leading edge of all of that stuff.
Yeah.
And yeah, I wish I look forward to as it gets more attention and it does get more, resources where we can get more robust research to tap into all the different areas that are needed in this space.
Yeah.
So I think
Yeah.
it's exciting times to kind of see
Yeah,
where, things are heading.
absolutely. It's very exciting.
Great. What is, let's see, something that you kind of wish folks knew about pelvic floor physical therapy or health that maybe they don't?
As- I honestly, that it's a thing. I feel like there are so
That's a good one.
like literally like people are like, wait, that's a thing? You do what? And like, yes, this is a thing.
Yeah.
It's a very important thing. And like still to this day, people are like, I didn't know that this existed. And I'm like, come on. Especially people who
Yeah.
have delivered a baby. I'm like, the OBs know that this is a thing.
Right.
Providers know that this is a thing, and it should be an
Yeah.
automatic referral, pregnancy and
Yes.
postpartum, because there's so many things that you can do.
Right.
So, like, yes, honestly, that this is a thing. Pelvic floor PT is a thing, and you can get help.
Yeah, I think that's such a good one, especially like when I've talked to people, especially if I talk to men, they're kind of like, And I'm like, you have a pelvic floor too.
Yes,
Everyone has a pelvic floor. Like this is not just a woman's issue or people with a vulva issue. Like everyone has one.
for sure, for sure. And we don't treat men in our practice, but I have a couple friends in the area who do treat men, so we will always refer
Mhm.
to them.
Right,
Yes, this is a thing for men as well.
right.
Yeah.
Yeah, this it exists.
Hey,
Oh, it's
hey.
crazy. Um, okay, another thing I did want to ask is what is like some of the most rewarding aspects of your work?
Just helping people. I just thought of yesterday. Okay, so yesterday I was at this networking event and one of my patients was there and we were just kind of we're all younger moms talking about life and new mom life. And my kids are a little bit older now, but her baby is 6 months old. And I was
Mm,
talking about, or she was talking about, we have this class here or this resource center called the Butterfly Center, where it's like a mommy and me group for 0 to 3 months, 3 to 6 months, 6 to 12 months. And
yeah,
anytime we have a new mom come in, I'm like, do you want resources? Here's this class, here's this lactation consultant, here's this and that. And she was like, yeah, I'm just so happy that you turned me on to the Butterfly Center because I met some mom friends that are in the same phase of life as me, which is so helpful. And like me too. It's like that was such a helpful thing to have when my kids were young. So just knowing that I'm helping people get the resources that they need and
yeah,
that, yeah, and I can help, I don't like change their life, but I can hopefully make their life better and again help them
yeah,
get the help that they need. It's pretty rewarding.
yeah. I would imagine so. I think just I don't know, getting to help in that small way that then carries forward, yeah,
Yeah,
for the rest of their life
for
is
sure.
very
And
special.
make some lifelong friends or like have the support that they
Yeah.
need through early motherhood. Yeah, it's awesome.
Great. All right. Well, we're getting close to wrapping up. Is there anything that you want to leave us with before we conclude?
I don't think so. I feel like we covered it all, like the theme being that
It
pelvic
was a
floor
lot.
is a thing.
Yeah,
Go get help.
right. Exactly.
Don't
It
have to
exists. You
suffer.
can help. Exactly. Don't suffer.
Yeah, don't suffer
Uh,
in silence. Yeah.
great. Well, thank you so much, Rachel. I really
Of
appreciate
course.
you talking with us today.
Thanks for having us or me.
Thank you.